Hello and welcome everybody to another session of Three Things Thursday. And I'm sorry we had a little technical difficulty when we started out, but we think we're all set right now. So today I am so excited. We have another of our P2P staff members joining us, Amy Miller. And she actually works out of our Gainesville office. She is awesome. She has lots of experience, and she's today going to talk to us about transition to adult healthcare. That's what we're talking about this whole month of January. And today we're going to talk about who makes up your team and what their roles are. And that's what Amy is going to share with us about. And also, actually, I think it's pretty cool. Amy, if you want to share the picture right about her shoulder that you can see. Amy, you want to talk about that a little bit?
Yes, I have a friend who is an artist, and I actually asked her to paint our roadmap. It is a literal map of all the icons that you can go to find our services that we provide. And in the roadmap, you can actually find healthcare transition information. And it looks just like this.
Yes. So cool. I thought that was awesome. And so, yes, so today we will actually share the roadmap. I'll show you on the screen, the website or the roadmap, and show you the transition page, exactly what Amy was talking about. And all those little buildings and those little things you can see on there are things that are clickable. And that's kind of what's on our, it's a roadmap is our other website. So we'll definitely share that. So let me share my screen and go to the PowerPoints. Hang on one second. All right, so yes, as we said, today we're talking about who makes up your transition team, who are the members of your team. So we'll talk a little bit about that. Amy will, walk us through what are their roles, all the different team members. And then like always, with every session, we have lots of tips, suggestions, and resources for all of you. So Amy, take it away.
Yes, this is your transition healthcare transition team, and your child is in the center. They are very, very important. And then you have the parent or the caregiver. The pediatrician is very important. And then you possibly have an adult specialist, a primary care doctor, and an educator. And the youth is the most important in this group because they are learning to advocate for themselves. And when they are self-advocating, that means they're letting others just know what their needs are. They're asking questions about what the doctors are doing and why things are important. They're asking for help when they need it. They're building a rapport and a confidence with the doctors so they can trust their doctors, so they know how to take care of themselves in the future. And your team should know about self-management, which includes understanding their own condition, whether it be if they have asthma and they need to, let people know that they have asthma and they have to use that inhaler, if they have cerebral palsy and they need help with certain functions, but they can definitely tell their doctors what their needs are, and they can explain their condition or diagnosis. They should be able to monitor their health status, which includes, if they have diabetes, for example, they could monitor their blood sugars. They can, whatever their diagnosis be. And the most important is that they have an emergency plan. If something were to happen, what they do, they need to know what hospital they're going to go to, who their doctor is, and their medicine list, so they can explain in case of an emergency. Okay, and as your child is growing up, they are becoming more independent. And so you are no longer going to be as much an advocate for them as you're going to be their coach. And a coach is very important. You're still part of the team. You're on the sidelines helping them advocate for themselves. and self-manage. And if they have questions, you're right there to help them. However, if your child cannot self-manage, then you step from advocate to spokesperson. They probably know their situation, and they're unable to advocate for themselves, but you can speak for them and be their spokesperson. And the age of transition is usually 18. It can be as old as 21. And if you have a pediatrician who specializes only in children, then they will help you start to transition before they turn 18. Find a family practice doctor who treats adults as well, and they will transfer all the information to them. However, some pediatricians, they're not just a pediatrician, they work with children and adults. And then the transition is just your child is becoming more of their own advocate. They're speaking up for themselves. They're learning to talk to the doctor. And you don't have to find a new doctor at that point. But if you have a pediatrician, you will need to find another doctor between 18 and 21. And finally, the healthcare transition plan versus the IEP, the individual education plan. It's, we mentioned that educators can be part of the team. And that is very true, because when you have a healthcare transition plan, it is not mandatory, but it is highly recommended. And you can speak to your child's teachers and implement that into their IEP so that they have health goals implemented in their IEP, and they have whatever may be needed to be implemented within their IEP. You can talk to their teachers and they can work on that. So your teachers and yourself are working on it.
All right. So thank you, Amy. So those are the roles. So we talked about all the different people and what their roles are. So your youth is most important. Then you have the parent and caregiver. Then you have the doctors and the other providers. And then you have your educators, and all of them are part of your team. And one of the big things, before I get into tips, I'll just say is one of the things is, unlike a transition IEP team where, everybody gets around a table, or now it's, gets on Zoom together and discusses all the different parts of transition. For a healthcare transition, you really will not be having all your doctors getting on Zoom together to have a meeting. So, you as a parent or the caregiver are the one who's primarily steering this process, and you would have to piece together things. So some of the tips are definitely when you're moving at age 21, when you're moving out of your your child is moving out of your pediatric practice, one of the things is to definitely ask for a healthcare summary. So health summary, could include things like diagnosis, medical care, what medications they're currently taking, and what are their general medical needs. So that's a great document to have, because then that can, when you're going to a new doctor, they don't have to go through a whole binder of stuff. They have that summary, which might be like 4 or 5 pages long. That might be useful, really helpful. Again, another thing is getting records transferred. If you have to transfer records from your pediatric doctor, whether it's a specialist or whether it's your pediatrician, making sure that the necessary records that you need in order to go to the new doctor is available and it's moving. Those are some things to think about. And then, like I said before, you as a parent are the one who's creating this plan. So that's what makes it a little different from an IEP transition. So and I would definitely, highly recommend putting the plan in writing. So you have some kind of checklist or some kind of writing, and then timeline, like when do you want to accomplish what? Definitely get your child involved. They are the main person that you're doing all this for. So as much as possible, get your child involved in the process. It could be small things like your child learns, maybe they can't read the medication names, maybe that's too complicated, but maybe they can, they can count how many tablets are there, and when when they need to call in for a renewal. Maybe they can work on putting reminders on their calendar, how to call up the pharmacy, those kind of things, or text the pharmacy. Now we have everything that we're doing, online. So you can text the pharmacy, you can get reminders, you can set up a reminder schedule. So those kind of things could be part of your plan. So writing your plan down is important because it helps create a kind of checklist for yourself. And then definitely creating a list of questions. So as you start looking for new providers for your child, create a list of questions that you would want to ask that new provider. So it could even be like, as you're making that phone call to see, like, hey, does, Dr. X, first of all, take the insurance that that your child might have at the age of 21? B, you could ask questions such as, does the doctor have experience seeing someone? If your child has a developmental disability, then saying, does the doctor have experience, with individuals who have a DD diagnosis? So you can make your own list of questions and even ask when you make that first phone call to your doctor's office to make sure that the doctor is a right fit for your child. So those are just some tips. And I know that in the previous sessions, we've spent time, with lots of other tips and suggestions. But I just wanted to, this is specifically regarding the role of each of the people in the group or the team. So before we go, I wanted to also share the two resources. So it is posted, the links are posted on that, in that Facebook message. So you can definitely access it there. But one is what Amy talked about, which is our roadmap to success. And I'll show you that page. We have a whole page on health transition. And then there is a website with really some, I think they're really neat, nifty videos, short videos, 5 minutes, 3 minutes videos on how to teach your child to become more independent as regards to healthcare. So let me just stop sharing and then I will reshare the website. So hang on one second. So hang on one second. So this is our parent-to-parent transition website, our roadmap, and this is the health transition. If you click health transitions, this is what shows up. So as you see, there is what is a transition plan. There are all these links that can definitely help you. There's a worksheet. There's a worksheet for the youth. These are two great documents because they really help you figure out where you need to start and what are some things that you can start on. This one is taking charge of my healthcare, and this both these workbooks are really awesome. They are done by Department of Public Health. We worked with them together to provide these workbooks, and they have really great information. They're available in Spanish also. So if I'm just going to scroll a little bit, and so we have here role of team members. It talks about who makes up your team, and then we will show this little short video also. Videos, so there is lots of great information on this page. I would highly recommend that you go in here, check it out, click on it. Definitely incorporating. There are some examples of how to embed health goals into your child's IEP. So definitely look at that. That might be something of interest. So the other resource is Healthy Transitions. It's from New York. But what I like is it has, it has really some of these nifty, I'm just going to click on this videos section. And if you go down, like there are these small little short little videos like scheduling an appointment, scheduling transportation, preparing for an operation, health insurance, our therapies covered, circle of support. We did talk about this in our previous sessions, and then they have all these short little videos that I think would be really helpful, as you're talking to your young adult about transition to adult healthcare. So just wanted to, show you guys these two resources. Like I said, there are lots of information, lots of resources, but this could be a good way to teach your young adult some of the self-management and self-advocacy skills that we talked about. So thank you again, Amy. Did you have anything else to add?
No, but
Okay.
thank you for having me. It was great.
All right. So again, as usual, you can always feel free to contact us. If you have questions, we can definitely walk you through your own transition, your child's transition, and talk to you about the various steps. So feel free to connect with us. And next week, we're going to talk about the concept of medical home, and that would wrap our entire month of transition to adult healthcare. And then in March and February, we're going to talk about behaviors. So everything that you would want to know about handling challenging behaviors. So we're getting some experts to come on to talk to us about those topics. And I'm so looking forward to that. But next week, we'll talk about medical home. So thank you again. And Amy, thank you for joining us today. And we will see you again next week. Thanks.